Hello, I'm Dr. Dennis McKenna. I'm joined today by John DePaula. JD, good to see you.
Good to be here, Dennis.
Today is Thursday, February 9th, giving you the update from Albany Med. And John, before we begin, it's Super Bowl weekend.
Yes, it is.
Who's your money on?
I'll tell you, I got to go with the Cincinnati Bengals. They got a hot quarterback right now, Joe Burrow. I'm thinking Cincinnati. How about you?
I want the Bengals.
There you go.
I'm a Raiders fan, full disclosure, but I want the Bengals. I have a bet with one of our young friends up in the Melody Center, some pizza on this. So
that's great.
Go Bengals.
It's going to be a lot of fun.
All right, let's pop open the first graph here. Cases in New York State diagnosed with COVID. This is more of a visual, John. The numbers are the numbers, but you can see they're coming down rapidly. Currently about 4,600 in New York State. Let's show the next graph. This is Capital Region. We see a very similar story here. Over the last 2 weeks, a series of days where the numbers are getting lower and lower. The number in the Capital Region is 249. So again, very encouraging by the trend of that line. Next graph here is specific to Albany Med, and this is admissions and discharges. And again, visually you can see we're really more in a single-digit phase, sometimes between 5 admissions a day and often more discharges. Of course, if you discharge more than you bring in, that's how your census goes down. And let's pop open the next graph there, and that in fact is what we're seeing. Here at Albany Med, we currently have 75 in the hospital. And in our most recent spike, we had numbers in the hospital higher than 120, so 75. Again, moving in the right direction. The breakdown there is 72 adults and 3 pediatric. Interestingly, when I looked at the numbers yesterday, all 3 of those pediatric were coming in the hospital for a different reason. So that's the information on COVID cases. This graph here, John, is variance. I know people are often curious about the variant, and what this graph shows is what we've now known for the last 3 or 4 weeks. Omicron is the dominant strain. In point of fact, of samples sent over to the Wadsworth lab, we're looking at 99.5%. Yeah. So essentially 100% Omicron in the area.
Exactly.
And the last graph we'll look at here is what we sometimes call the black, blue, red graph, and it's 3 different lines. If you look at it horizontally, left to right, we're looking at periods of time. The line on the bottom is the red line. That represents the vaccinated population. And what you can see is recently there was a very slight uptick as far as people getting admitted to the hospital, even if they were vaccinated. But if you look at the line above that, which is the blue line, that represents the unvaccinated population. And you can see there was a very steep pickup as far as that. Importantly, we're also seeing that number come down as well. And then what you're left with at the top is the black line. And what we call that is the vaccine effectiveness, which is really a way of you measure the likelihood of coming in the hospital, whether you're vaccinated or unvaccinated. And the vaccine effectiveness is still running around 90%. So very, very important data to share with everybody here. Speaking of vaccines, John, we have 2 more booster clinics available on campus this week. Friday, February 11th from 7 to 11, and Saturday, February 12th from 7 to 10. Those will be in the B as in boy, E, so BE lobby, and you can get either Moderna or Pfizer. We have both there.
Great.
And there are some people who got the vaccine out in the community, and they might want to get that information uploaded into our employee health system records. How do they do that?
Exactly, Dennis. So we've got a great service that's being provided. When you come into the B concourse, we have staff there that will upload your card, your vaccination card that you were actually boosted. They will upload it in the Quick software that we use to kind of track to make sure staff are boosted. So if you've gotten vaccinated off-site, bring your card in, and we'll have that group load up your card and update it in Quick.
Now, you could also do it on your own if you want.
You can.
I did it myself. There's information on the intranet page, but if you want any help with that, we're happy to help you.
Yeah, I hear it can be cumbersome. Again, check your messenger. We're doing it every day this week, even on Saturday, to provide that service for our staff.
And it's important, if you have received the vaccine in the community, that we have that information so we know that you've gotten the booster. So great. John, the weather is better today than it was a week ago. We had a pretty significant snowstorm not that long ago. And at the time, our facilities crew came through and did a remarkable job of cleaning the whole area so that not only our staff but our patients could access our care here.
Yeah, they always do, Dennis. I'll tell you, I'm always impressed. I mean, I travel the Northway and then the Thruway to get here, and I'm always struck by the fact that typically on our campus, our roads, our sidewalks are pretty much clear. And Scott Smith is the group that leads that team, does a remarkable job, and just make sure everybody's safe. Our staff as well as our patients, really an incredible job by that team. And actually, I was told that on our Facebook page, that actually got the most likes. There was a picture of that and got the most likes from people following us on Facebook.
They have lots of fans, including the two of us.
That's exactly
so great
right.
job to our facilities team, and thank you so much for everything you do. John, if people look at the pillars, they will notice that they're lit up red, and periodically we'll light up the pillars different colors, depending on what may be happening. This month is Heart Month. And obviously the color that goes along with Heart Month is red, and so that's why they're lit up red. The Heart Ball, which is something that happens in the Capital Region every year, normally takes place in February, which is Heart Month. It's been moved a little bit, but we're still going to have it. And Albany Med is obviously very significantly involved in the Heart Ball. This year, two individuals well known to this campus are being recognized.
Yeah, two longtime Albany Medical Center icons. Our longtime CEO, Jim Barba, will be honored, as well as Dr. Lewis Britton, longtime cardiothoracic surgeon here, and he actually served the last couple of years here as interim department chair of surgery. So two great individuals that really helped build the medical center.
No question, and we're very proud of our partnership with the American Heart Association. We're also equally proud of all the great cardiac care we provide in the Albany Med Health System, all coordinated in a way that I think people of the region benefit from. So congratulations to all of you. Also, John, February is Recreational Therapy Month. Whenever we're given this information, we love to share it. We want to make sure we recognize everybody. Recreational therapy provides so many great services here. They do it up on E2, which is our inpatient mental health unit, as well as the bedside throughout the hospital. And let me read a couple of things they do. They do what's called leisure diversion, relaxation interventions, and psychoeducational treatment. So if you think about it, being in the hospital is a very stressful environment. And obviously having some diversion from that is important for not only your physical health, but your mental health. And they provide a remarkable service. So congratulations and thank you to all of them for that work. John, we're having a blood drive this month. We have one every month on campus. I think we've heard lately that the blood needs are significant.
They absolutely are, and it's really important that Albany Med, our Albany Med community staff, really try to give blood and support these blood drives.
So this one is going to be on February 25th. Obviously, it'll be in F309, as it always is. And we encourage any of you who have donated blood in the past to do so again. If you haven't, maybe this will be the first month you do it. If you use the scheduling system, what's really interesting is you get a notification where your blood went. Wow. And so I use that now because it's kind of fun to see where your blood went and who it helped out. So it's very important. So blood drive coming up. John, anything else going on that you'd like to talk about?
I'll just mention I had a really, really good experience yesterday. I was rounding at our breast surgery center.
Right.
Dr. Beth Whiteside, as well as Jennifer Dwyer, kind of gave me a tour. And really, Dennis, you talk about our mission and serving our community. Some really incredible work that they do there, incredible service that they provide to the women in our community. And they're recently celebrating, end of January, they had an FDA inspection that occurred towards the end of January, and they passed it with full compliance. So really incredible service that they provide and job that they do. And actually, if you look at the monitor, take a look at their whiteboard celebration and sort of the line at the bottom of that celebration. I think you might find that interesting.
Yeah. We did appreciate that shout out by the folks there. Dr. Lynn Choi, also a breast surgeon who works there, and they recently received the highest level of accreditation that you can get at a breast center. So very comprehensive care from diagnostic to therapeutic, and it really takes an entire team. And they truly do take care of themselves and they take care of each other, so that's wonderful. All right, John, that's it. Anything else?
That's it, Dennis.
All right. We wonder where Fred is. You think Fred?
He's in Tasmania.
Is he really?
He's keeping in touch with me, and I just a chance to call that out. I mean, Dr. Venditti just absolutely magnificent support of me, and yeah, he's actually in Tasmania right now.
All right. Well, we miss Fred. We hope he's doing well. We look forward to seeing him come back soon. And Super Bowl this weekend. For those that are working here this weekend, we appreciate you now more than ever being part of our team, delivering that care 24/7. And I'll say, go Bengals. I think you're saying the same.
Go Bengals.
All right, very good. Once again, we ask that you please take care of yourself, take care of each other, and we'll see you next week.